Good afternoon. Thank you for joining me for Hazelwood Auto Group's 2023 Employee Benefits Open Enrollment. This covers the plan year that's effective May 1st, 2023 through April 30th, 2024. This is going to be a high-level overview of your employee benefit options, and additional details are always available in your employee guide. So welcome to your benefits enrollment. This is your opportunity to review your plan options, enroll or remove dependents from coverage, add or confirm beneficiary information, and ask questions. It's really important that if you have any questions regarding any of your employee benefits, that you get those questions answered so that you have all of the information that you need to make the best plan decisions for you and your family. Because this is the annual open enrollment, I want to make sure that there are a few things that you are aware of. As mentioned previously, this is open enrollment, so you do have that opportunity to enroll and change dependents and change your elections or enroll for the very first time if you haven't previously. But it is important to remember that the changes that you make now, or the enrollments that you make, those will be in effect until the end of the plan year, April 30th. You are unable to make changes to those plans or changes to those enrollments unless you have a qualifying event or have a special enrollment. So examples of those are changes in marital status, or maybe you have a new baby or newly adopted a child, loss of hours or a change of employment status, and loss or gain of other coverage. So just remember that what you elect at this time is effective May 1st and good through the end of the plan year. So we're going to go ahead and review your 2023 benefit plan offerings. We're going to be covering your 2 medical plan options with Aetna, HSA administration for those that are choosing the qualified high deductible health plan. This is through PayFlex. Your flexible spending account options also through PayFlex. Your 2 dental options with Delta Dental of Washington, your 2 vision options with Emeritus, and the Employee Assistance Program also through Aetna. So we're going to go ahead and get started with your medical plans. Both options are through Aetna, the HSA 2500, which is a qualified high deductible health plan, and the PPO 1500, which is a traditional PPO. Now, the HSA 2500 has an individual deductible of $2,500 and an aggregate family deductible of $5,000. What that means is if you are covering 1 or more family members, you are all subject to that family deductible, and that must be met together. Coinsurance on the plan is 20%. That means that the plan pays 80% and your cost share is 20%. And that full individual or family deductible, depending on your coverage, has to be met before coinsurance begins. Now, preventive services, those are paid at 100% and not subject to the deductible. But everything else, whether it's an office visit, a trip to the emergency room, or prescriptions, that's going to go to your deductible. There is an annual out-of-pocket max, and that is the sum of your deductible and coinsurance, and it's the most you're going to pay during a plan year for covered expenses. For individuals, that's $5,000. There is a family max of $10,000. This is not an aggregate, so no individual will pay more than $5,000, and the combined total of all family members will pay no more than $10,000. It does have out-of-network benefits, same level of deductible. Coinsurance is higher, so you actually pay 40%, same out-of-pocket maximum limits, and prescriptions as well. So you will maximize your benefits by utilizing an open choice provider, so staying in network, but you do have coverage outside of that network if necessary. Now the second plan is the PPO 1500. As a $1,500 individual deductible, family max of $3,000, so that's the most in deductible expenses a family will pay, but it is not an aggregate, so each person has that The annual out-of-pocket maximum works exactly the same way. It's the sum total of your deductible, coinsurance, and for this plan also copays. Max per individual is $4,000, and max family coverage or max family out-of-pocket expenses is $8,000. The office visit is $30 copay. Outpatient diagnostic labs and x-rays, that's going to be coinsurance. And then prescription drugs, depending on the tier, whether it's preferred generic, preferred brand, or non-preferred, you're going to pay $25, $50, or $75. The plan also has out-of-network coverage. You're going to pay a little bit more. The deductible is the same limit, but coinsurance is 40%, so you've got 40% cost share. Has the same out-of-pocket maximum limit, and same for prescription drugs. And again, you will always maximize your benefits by utilizing an in-network provider. Now, for anyone who's considering those qualified high deductible health plan options, I want to spend a little time going over health savings accounts. These are powerful tax saving tools that allow you to set aside pre-tax dollars to be used for not only the medical, but dental and vision expenses as well. Because of the tax savings, the IRS has set some very specific eligibility rules. So first, you've got to be enrolled in a qualified high deductible health plan. So you've got two options for those. You can't be claimed as another person's tax dependent. You can't be covered by another non-high deductible health plan. So if your spouse has a traditional PPO plan and you like being covered by both, you cannot contribute to a health savings account and be enrolled in that other plan. You can still be enrolled in it, you just lose the ability to participate and contribute to a health savings account. And that's the same as not being covered by your spouse's FSA. The FSA, because it covers medical, dental, and vision, is considered first dollar coverage and eliminates your ability to participate in the health savings account. If you don't meet these qualifications, you can still enroll in one of those two qualified high deductible health plans. They are great plans by themselves. The only thing that you're losing is the ability to participate in a health savings account. Now you may be wondering, well, why do I want to participate in a health savings account? There are a lot of advantages to being able to do so. The first are triple tax savings. Your contributions into the account come out of payroll on a pre-tax basis, which reduces your taxable income. While your funds are in that account, they earn interest, and that accumulates tax-free. And then the money that you pull out to be used for qualified expenses is also tax-free. So you're getting to pay for those bills on a tax-free basis. Health savings accounts are yours, even if you change medical plans, you change employers, or you retire. Once that money is deposited into your health savings account, it remains yours and can go with you wherever you go. Now, even if you are no longer enrolled in a qualified high deductible health plan because you've decided to change plans or you've retired, the funds in the account can still be used for qualified expenses. You can just no longer contribute to the health savings account. And there is no use it or lose it rule. So there is no timeline that says you've got to spend down the account by the end of the year or forfeit dollars. If you don't end up using it, great, you've had a wonderful year. Those funds stay in your account and can be used for future expenses. And there's a lot of flexibility in contributions and use. So you get to decide how much to contribute and how those funds are going to be used for qualified expenses. Now, looking at contribution sources, there are a couple different ways this can be done. The employee, as the account holder, is considered the primary source for contributions. You get to decide how much to contribute. You can choose not to contribute at all, or you can choose to maybe start low, $25, $50 a pay period, and then increase later in the year as you become comfortable with those deductions. Or you can decide I'm going to front load my HSA so that it's available for me. You can start high and then reduce your contributions at some point during the year. You just need to go to payroll and say, I'd like to change my HSA contribution, complete paperwork, and that change can be made. Now, family members can also contribute on your behalf. They don't receive the tax benefits, however, because it's your health savings account. So if they make a contribution, it goes into your account on a post-tax basis. And then when you complete your taxes at the end of the year, then you will have an opportunity to declare that post-tax contribution and have it deducted for receiving the pre-tax benefit for that contribution. And the IRS does look at and adjusts contribution limits every year. For 2023, an individual can contribute up to $3,850. If you are covering one or more family members, then you have the family limit, which is $7,750. And if you're 55 or older, you can contribute an additional $1,000 above that annual limit every single year. Okay, so how does the medical plan work with the HSA? Well, all preventive claims, those are going to be paid at 100% when billed that way. You don't have to worry about any out-of-pocket costs. For claims that are applied to your deductible first or to co-insurance because you've already met your deductible, you can use your HSA funds to pay that provider bill directly, or you can choose to pay out of pocket and then reimburse yourself. If you don't have enough in your HSA, or you prefer to not use it for this particular bill and like to see it grow for future expenses, then you just go ahead and pay the claims yourself. You don't have to worry about missing out on the opportunity to reimburse yourself with the HSA. There's no time limit, so as funds continue to grow in that account, you can retroactively reimburse yourself. Any claim that is incurred after you have opened up the health savings account is eligible for reimbursement or to be paid directly from that account. And these accounts are self-managed, so that's an important thing to keep in mind. There's no third party that you're going to submit claims to and they're going to say, yes, this is a qualified expense, we'll go ahead and approve reimbursement. It's up to you to know what is and isn't a qualified medical, dental, or vision expense. And you need to keep the documentation for that expense and their reimbursement or use of those HSA funds. The only time that a third party actually looks at your health savings account is if you get audited by the IRS, and then they're going to want to see documentation that you've had a qualified expense to back up all withdrawals from your health savings account. Now earlier when we were going through the eligibility rules, I said that you can't contribute to a health savings account and also participate in an FSA. Well, just to confuse things, there is an exception to that. So if you are enrolled in a health savings account, you can be covered by a limited purpose FSA. And Hazelwood happens to offer both to give those that are enrolling in a health savings account that flexibility. Whereas general purpose FSAs cover medical, dental, and vision expenses, limited purpose FSAs only cover dental and vision. And this is what preserves your ability to contribute to a health savings account. The current FSA contribution limit is $3,050. Thing to remember with FSAs though, HSA funds are not use it or lose it as FSA funds actually are. So you don't want to participate in a limited purpose FSA unless you plan on maxing out your contributions to the health savings account first. That's a safer place to contribute because you never have to be at risk of forfeiting any funds. However, if you're going to max it out and you want more tax savings opportunities and you know you're going to have additional expenses, then you can contribute to that limited purpose FSA. And just remember, those funds should be earmarked only for dental and for vision. So we've just spent a lot of time on the very specific health savings accounts. Now I want to go over flexible spending accounts. These are also tax-favored accounts, and they're offered as healthcare expenses and dependent care expenses. And for those that are choosing a traditional PPO style plan but want to take advantage of the ability to save taxes on some anticipated expenses, this healthcare FSA is what you want to look at. For everybody, regardless of which medical plan you choose from, dependent care. You've got kids, if they're in daycare, that's something you want to participate in. So for healthcare, there are two FSA options. There's the general purpose that covers medical, dental, and vision, and there's limited purpose that can be used for dental and vision only. The annual limit for 2023 is $3,050, so that's how much you can contribute for this calendar year. But you don't have to contribute that much. Whatever amount you do choose, that's going to be front-loaded at the beginning of your eligibility. So that is a really nice feature. So let's say you decide, I think I'm going to need $2,000 this year. I'm going to elect $2,000. That will be divided over the pay periods for the remainder of the calendar year, but all $2,000 will be available to you on day one. So if you've got a large orthodontia bill due and you know that's coming up, you can go ahead and elect, and it's all available to you to pay that bill, but you'll be having those deductions spread out the rest of the year. Now, funds in these accounts can only be used for those qualified expenses. So just like that health savings account, you've got that limitation. And there is a use it or lose it provision. So you don't want to over contribute to your FSA and find that at the end of the year you've got too much money sitting in the FSA and you're scrambling for expenses that you can turn in as qualified expenses. So there is a rollover allowed for 2023. That rollover is $610, which means you can have $610 left in the account and just roll it forward into the next year. However, anything above that dollar amount is forfeited. So you don't want to end the year with $1,500 sitting in your FSA and you're wondering, how do I spend down my account so I don't actually forfeit any of my dollars that are sitting in the FSA? So it's really important that you think about how it's going to be used. Do you like to buy a second pair of glasses? Do you seem to always incur some expensive dental work? How many copays are you going to be paying this year? Do you have regular prescriptions, or do you make several trips to the doctor and you're going to know you're going to have those out-of-pocket expenses? Think about that. Base your contribution on that amount, but know that you've got that rollover that gives you a little bit of wiggle room. Now, the second type of flexible spending account, that's specific to dependent care. This allows you to set aside up to $5,000 per calendar year, and it applies to children under the age of 13 or tax dependents unable to care for themselves. So that could be elderly parents who are living with you that need elder care while you're at work, or disabled children that are unable to care for themselves. As long as you've got those qualifying expenses, you can run them through the dependent care account. Now, you can only be reimbursed for amounts contributed year to date. So this account is not front-loaded like the healthcare expense account. So some people will incur their expenses, and once $5,000 or however much they've contributed is met, then they will submit one large claim. Others can choose to submit claims as they are incurred, and if there's not enough in the account yet to fully reimburse you, they will reimburse you what they can and then send additional reimbursements as additional funds become available. But this account also has a use it or lose it provision, and no rollover is allowed. So it's really important that you put a lot of thought into dependent care and don't over-contribute. So if you have small children and they're in daycare, you know $5,000 is you're going to go through that pretty quickly, and you really should be contributing to this because it's a great way to pay for up to $5,000 of that care you know you're going to be paying for on a pre-tax basis. As kids get older and the level of care that they need reduces, then your costs are going to reduce, so make sure that you adjust your dependent care contribution. It's still a great thing to do if they're under the age of 13, but just remember that you've got fewer qualified expenses. It's harder to find those qualified expenses at the end of the year if you end up with too much money, and because there's no rollover, you don't want to be in that position of having any of your funds subject to forfeiture. Okay, now we're going to cover your dental plans. You have dual choice. You have two plans to choose from with Delta Dental of Washington, the low plan and the high plan. They both have $50 individual deductibles to a maximum of $150 for a family, and both waive that deductible for preventive services. The annual benefit maximum is $1,500 on the low plan or $2,000 on the high plan, and that is the individual amount for every person that is enrolled for their covered expenses during the plan year. So every member of your family that's covered has their own $1,500 or $2,000 depending on the plan available for their expenses. Now both plans pay for Class 1 preventive and diagnostic at 100%. The deductible does not apply and there is no coinsurance cost. Class 2 basic services, things like fillings or root canal or having a tooth pulled, that's going to be paid at 80%. And your cost share is just 20% and the deductible does apply. Now the low plan does not cover Class 3 services. These are major services, things that are bridges and crowns and implants. But the high plan does pay for those class of coverages, but pays at 50%. Both plans do offer out-of-network benefits. You're going to share your deductible with in-network. The benefit maximum is shared. The covered percentage is the same, but the thing to remember if you were seeing someone outside of the PPO network, then those providers who are not contracted with Delta Dental can balance bill you. So what that means is that if their regular fee for a particular service is $200 and the allowed amount from Delta Dental is $150, if you're seeing an in-network provider, Delta Dental will process that $200 claim as $150 allowed and then pay the appropriate percentage depending on what class of service. If you're seeing an out-of-network provider, that $200 claim will be adjudicated as an allowed amount of $150. They'll still pay that $150 based on the correct percentage, but that non-network provider can bill you not only your coinsurance percentage, but they can bill you that additional $50 that they're not required to write off because they have no contract with Delta Dental. So you do have the flexibility of going into both in-network and out-of-network, but remember your costs can be higher utilizing a non-network provider. Now you also have a dual choice in your Emeritus Vision plans. You've got a low plan, high plan. Both will pay for an exam with just a $10 copay. Both cover prescription lenses, single vision, lined bifocal, or lined trifocal with just a $25 copay. There's an allowance to go towards frames. On the low plan, that is a $150 max allowance. And for the high plan, you have an additional $50 because you have a $200 max allowance. Contact lenses. Both plans, you can be charged up to a $60 copay for the contact lens fitting and evaluation. And then the allowance is different for contacts, $150 under the low plan, $200 under the high plan. And then both plans do allow members to earn a lifetime benefit for LASIK surgery. And then more details on this and other portions of coverage covered by these plans can be found in your employee guide. Now the frequency of services under the plans is slightly different as well. Both plans cover exams every 12 months and lenses or contacts, not both, it's one or the other, every 12 months. But frames can only be reimbursed or replaced every 24 months under the low plan, and you could do them every 12 months under the high plan. Now we're going to cover your Employee Assistance Program. This is paid for all benefit eligible employees by Hazelwood, so you don't have to elect this coverage. You're going to be automatically enrolled in it. It's arranged through Aetna Resources for Living, and it provides 3 sessions, face-to-face or telehealth, per issue that you come to them for. So it's really important to remember that this is 100% free, no cost shares, no copays, and it's confidential. And Hazelwood has chosen to put this in place so that you and your family members have easy access to care for in-the-moment support when life throws you a curve. So there's a lot of things that they can help with. Anxiety and depression. They can help with alcohol and drug problems, grief. They can provide some legal and financial assistance. They can help you find childcare or elder care. Their website has a lot of information about the services that they provide, plus self-help tools. I'd really encourage you to check it out. Maybe there's something that would be helpful to you right now. But if not, the more you're familiar with the EAP, the more likely you are to remember you have this free and confidential great program that you can reach out to 24/7 and get some help. And remember that those 3 sessions renew for each thing that you present with. So let's say, for example, you lose a family member and you are suffering from that loss and you're dealing with grief and you want to talk to somebody. You can reach out to your EAP and have 3 sessions. And then maybe, a few months down the road, you're doing better with that grief, but now you're suffering from depression and anxiety. That's something new. You've got 3 more sessions to talk to them about. So it's a great program. Check them out. Take a look at what's available. And remember, it's a wonderful benefit that Hazelwood is providing to you free of charge, and it's confidential. So this slide is just to show you how easy it is to find an in-network provider. As previously mentioned, that's the way to maximize your benefits. You will always receive the highest level of benefits by utilizing somebody in-network. So it is as easy as going to the carrier websites, selecting Find a Doctor or Find a Dentist, select your network, and then putting in the parameters of who or what kind of doctor you are looking for. So you can search by individual provider, or you can say, I need a specialist, I need a dermatologist. That helps narrow the field so that you've got a reasonable list of providers to choose from. So your employee guide has detailed information, step-by-step instructions on finding in-network providers. And this, again, is just an example of how easy that is. Now I just want to highlight some additional ways to access care. Your employee benefit guide has more details on all of these, plus additional value-added services, but these are some of the most important and most helpful that you should be aware of. So your Aetna plan provides a mobile app which gives you easy access to network doctors, an ID card so you don't have to carry it around, and the ability to check on prescriptions and claims. VIP Concierge, it's personalized service to help you understand your benefits and be a better consumer of your benefits. Virtual care, something that we've all grown to love in the last few years, available 24/7 and easily accessed through that mobile app. And also NurseLine. This is my favorite of all added value benefits. 24/7. It's a phone number that's on the back of your ID card, and it gives you the ability to talk with a registered nurse about something that's happening in the moment with you or a family member, and they will offer suggestions on how to mitigate what's happening in the moment, but then work with you to decide next steps. They may say this is something that you should make a follow-up appointment with your regular physician. As soon as they're open, give them a call and make an appointment. Or they may suggest that you go to urgent care, and if one's not open at that moment, then in the morning, go to urgent care. And in some cases, they're going to say, this is serious. We'd like to see you in the emergency room. Please head to your nearest emergency room. It's a fabulous resource to have. There's no cost, and they're just a phone call away. So again, your employee guide has lots more details on these services, plus additional services that are available to you. So now your next steps. We've gone through all of your employee benefit plan choices. You've had lots of information. Remember, your employee benefit guide gives you more details on everything we've talked about. But now you've got a to-do list. So you're going to complete your benefit enrollment process by going to the UKG Pro solution, and you're going to navigate to the menu, and through that get to manage my benefits. You're going to complete all of your benefit elections or changes, or you're going to decline coverage if you don't want it. You'll select review, make sure it is exactly what you've wanted, and then choose checkout. And then you're going to check out to complete the benefit enrollment process. You don't want to finish unless you've hit that final checkout and receive the confirmation that it's been submitted. If you're wondering about the due date, you're going to give HR a call and confirm that due date, and you want to make sure that you have everything done in UKG by that date. That ensures that you will have ID cards in hand by the time your coverage becomes effective. So if you have questions, where do you go? Well, Brown & Brown is here to help. We've created that employee benefit guide that is available to you. Lots of details there, including phone numbers for all of the carriers. You can always contact customer service for any of the carriers and ask them questions. Contacting your provider can be useful if you are looking at having a procedure done and you want to know how that's going to be covered. They can give you billing codes that you can then provide to customer service, who can utilize that to say, okay, this claim would be processed this way. And please feel free to contact Brown & Brown. Stephanie Kuntz is the Senior Account Manager on the account, and Jenny Childs is the Account Manager. So both are available to you and happy to help with any questions that you have. And it is really important that if you have questions or you're not sure which plan is the right one for you and your family, make sure those questions get answered so that you can make the best decisions possible. So I know this was a great deal of information. I hope that it's been helpful to you. Remember to reach out if you have questions, and have a wonderful day. Thank you.